Hello everyone, welcome back to another OET speaking lesson. This time we're going to look at how to deal with a difficult patient, and it's going to include a brand new speaking role play for you to take a look at and then practice at home. Now, this was a question that came in from one of my students, Tharushi, who asked, can you give us some tips on how to convince a difficult patient? I feel like I'm repeating the same information and vocabulary. And in some role plays, even if we convince the patient twice, they still don't agree. So, in a case like this, what should we do? How should we approach it? So, we'll take a look at this today, and this is going to be useful for everyone. I am going to be using a brand new role play for you for doctors, but it's going to be useful for everyone because you can take the same approach when you're planning in your 3 minutes, and I'm going to go over that approach now. And then you can use very similar language if you come across something like this. My name's Sona, I'm your online OET tutor with Bose Learning, and I'm a premium preparation provider of the OET. Thank you for joining today. If, like Tharushi, you have a question, feel free to pop it down and I'd be happy to help if I can, because my aim is to try and provide you with as much good quality free information as I can, and I have over 200 videos on my channel already, so do check them out. Okay, let's get started, and let me begin by reminding you that in the test you'll get 3 minutes to prepare your role play. And in this 3 minutes, you should look out and think about what kind of obstacles or potential blocks might the patient present you with. So look out for these. Use the prompts as clues to try and identify these obstacles, and then think about how you can tackle these. So I'm going to show you a role play now, and all I'd like you to do first of all is to spend a minute looking out for any obstacles or potential blocks by the patient. So this is where you use your detective skills to try and anticipate this. Okay, here's your role play coming up, and your 1 minute starts now. Okay, so as I say, this is the kind of thing you can be doing in your own 3 minute preparation. You read it, you understand it, and you start thinking about any of these potential blocks or problems that the patient might be facing. So, how many potential difficulties have you spotted? I spotted six. And six kind of blocks that might come from the patient. And when I mean blocks, what I mean is you offer some advice or a suggestion, and the patient blocks you and says, no, I can't do this. So I've spotted six of these. Let's take a look at them. So the first one is that the patient hasn't been attending the physiotherapy sessions and wants to talk to you about their concerns. So you already know that there's some kind of issue going on here. They've not been attending and they want to talk to you about this. Then the task tells you that you have to explain the benefits of physiotherapy. So you've got to think, why do I need to explain the benefits? Well, obviously, because the patient hasn't been attending. So there is a block, and I've got to overcome this for the patient's benefit. Address the patient's concern about exacerbating the knee condition. So, again, what kind of concerns might the patient have? How are you going to deal with these? Plan what kind of concerns they might have, try and predict what kind of concerns they might have, and then plan some possible solutions to unblock that. Share success stories of other patients who have benefited from physiotherapy. Why do you need to share success stories? Well, I'm guessing, I'm using my detective work here, and I'm guessing that maybe the patient has had some horror stories. So they're coming up with some horror stories, so you think of some success stories. Then discuss the importance of physiotherapy in preventing further complications. So, again, why do you need to do that? Because you still have to convince the patient that physiotherapy is a good thing. So, this is this idea of having to explain things twice, accepting and listening to their decision without being judgmental. That's really important. But still, it's your job to try and convince them of what you think is best. That's your duty of care for your patient. You still have to be non judgmental, you still have to accept their own decision, but you have to give it your all to try and impress upon them the importance of physiotherapy. And then finally, the sixth one, offer reassurance that the process will be closely monitored. So maybe there's something here, maybe the patient doesn't think the physiotherapist is listening to them or something, so you have to offer a final bit of reassurance. So these are the 6 places where there might be some potential issues going on. Now that we've identified what they are, the next step is to spend a further 2 minutes, off 3 minutes of course, trying to plan what you're going to say. So grab a piece of paper and a pen, hit pause if you haven't got that to hand already. And when you're ready, press play, and I'm going to give you 2 minutes to try and think of some nice phrases or expressions that you can use in these examples, and then I'll give you some of my own suggestions. Here we go. Okay, and that's the end of your 2 minutes. So let me give you some ideas on how you can tackle any obstacles or potential blocks by the patient. And I'm going to give you some different ways of doing so. So each time starting in a slightly different way, so you're not repeating yourself again and again. So the first challenge, if you remember, was that the patient hasn't been attending physiotherapy sessions. And that's given to you in the background information. But actually, there's no need to start by saying anything about this yet. All you want to do is to find out how the patient is feeling and how they're doing first. So you don't want to start the role play by sounding aggressive or accusatory and say, why haven't you been attending your sessions? Don't do that. Just start by finding out how they are and being gentle, and then slowly we can progress to what's actually going on. So we'll move on to block number two, and this is about you explaining the benefits of physiotherapy. So, so the patient might say, well, I'm feeling okay, doctor, but actually I'm quite achy and my joint hurts a lot when I move, and I can't move my knee. I can't extend my knee maybe fully. And you can say to them, well, one of the benefits of physiotherapy is that the exercises are designed to help just this. For example, they will increase your range of motion. Then they're also great for building up your strength and improving your overall function. So you're still not addressing the problem of them not attending the sessions. You're just giving the benefits at the moment because you haven't heard from the patient that they're not attending yet. And what we're doing here is listing the benefits, and then we're giving signals to signpost the example, first example, and then second example. So we're staging our response and making sure to pause in between to give the patient time to say anything. Now, this third block was address the patient's concerns about these exercises exacerbating the knee condition. So perhaps the patient says to you, well, it's all very well you say that, doctor, but I've stopped going to the physiotherapy sessions. Now, the first thing to do is to tackle that bit. Don't just go, oh, but physiotherapy sessions are fantastic. Instead, try and find out why, what's made them not go, and then you can address that. So you can say, can I ask why you stopped going to the physiotherapy sessions? And the patient might say, well, I just didn't want to go, just kind of cut you off again. And then ask in a different way. Was there anything you were particularly worried about? So try and get to the bottom of these concerns that have been listed on your task card, because then you'll know how to address them. So the fourth concern was share success stories of other patients. So, we go back here. Was there anything you were particularly worried about? Well, yes, because my friend had a knee operation, went for physiotherapy, and it was so bad that it's terrible. So now you know why the patient is not convinced by it. They've heard from other people how painful physiotherapy can be. And you can say something like, oh, yes, I can see how that must be off putting. You can acknowledge that physiotherapy can be difficult at times, but there are lots of success stories I can tell you about. Pause, check with them. Is it okay if I share with you a story about one of my patients who, like you, was in their 50s and actually had a replacement knee put in? So you're using quite casual language to try and encourage them, make it sound less formal. It's serious, but you're using everyday language to discuss this. They were in a lot of pain at the time, but with some determination and perseverance with the exercises, because we need both of these things in physiotherapy, it's not a magic cure. They have done so well in their recovery that they are actually running a 5K charity run this weekend. So while running might not be for everyone, physiotherapy really does help, and I strongly recommend you start the sessions again. So you're emphasizing your suggestion, your recommendation. What do you say? Could you give it one more go? So check with the patient. What do they think? What's their feelings? Do they think they can try again? You're not saying they have to, because of course they don't have to do anything. You're just trying to convince them. Then we come to block number 5, discuss the importance of physiotherapy for preventing further complications. And they might say, well, that's nice that your patient is doing well, but my friend who had physiotherapy was in so much pain and they found out that she had torn more muscles and had to go back in for further surgery. And you can say, oh, well, I'm sorry to hear that. So address that concern and then say, I totally understand that you're worried about having to go through surgery again. But normally, that's the other good thing about physiotherapy. I don't know what happened to your friend, so I can't really comment. But normally, physiotherapy greatly cuts down the risk of having to have surgery again because you're strengthening all that area around the knee and giving yourself the best chance of recovery. So again, you're trying to explain this importance of doing these exercises. Finally, in the OET, your patient will agree with you. They might not in real life. You'll probably have patients who walk away from your consultation, from your surgery, and you'll never see them again because they just don't believe in what you said. But don't worry, in the OET, the patient might be difficult, but they will always come round to you in the end. So there's a little bit of reassurance that's needed. So the patient might say, well, I can try again, but I'm just worried about progress. How will I know if I'm getting any better? And first of all, acknowledge that they've accepted your point of view and say that thanks, it's good to hear that you're up for trying again. Again, you can keep the language fairly informal because obviously that patient is quite anxious and you want to reduce their anxiety. And then you can say, let me reassure you that you and your physiotherapist will work together and your progress will be monitored carefully. So if anything doesn't feel right, just talk to them and explain, and they'll be able to adjust things to suit you best and get the best results. How does that sound? And again, always check, how does it sound with them? Do they think it's a good idea or not? But by this time, don't worry, in the exam, they will agree with you. Okay, well, I hope you found that useful. What I'm going to do now is show you the patient card. So feel free to take a screenshot of this so you can practice with a friend or a colleague. So remember, this was the doctor's card, and then this is the patient's card. So take a screenshot now. And if you do want some more information about my pre-recorded material, which I've tried to keep as low as possible in cost for you, take a look at the info box below. I've put in some discount codes as well for you. And these courses are all pre-recorded, so you can watch them in your own time. And if you like this video, I'd be so happy if you could help me grow this channel. Just share it with friends, colleagues, share it on your Telegram groups, give it a like and drop me a line to say hi as well. Or as I say, if you've got questions, drop me a line as well. If you'd like to sign up for a free dose of all things OET, just scan on the screen now. And thank you very much for watching. As I say, I've got over 200 videos for you to choose from, so hopefully you'll find something else that you find useful again. Thanks very much. Take care and see you soon. Bye.